Now to the pandemic. 444 new positive COVID-19 cases announced today by Utah's Department of Health, pushing the state's overall positive rate up to 6%.
The rate jumped up from 5.7% since last Friday. This is concerning for state health officials, and here's why. Look at these numbers. For the past 7 days, June 16th through today, Utah's Department of Health reported 3,298 new positive COVID cases. That's an average of 471 per day, with a 7-day positivity rate of 12.5%. Compare that to just the week before, June 9th through 15th. Officials say during that time, there were 2,286 new cases, an average of 327 per day with a 7-day positivity rate of 7.6%. These numbers have pushed our state to the overall 6% number. The state's increase of COVID numbers has Utah's epidemiologist, Dr. Angela Dunn, concerned. And tonight, she's issuing a strong warning to state leaders. We have team coverage tonight and begin with news specialist Tanya Dean. Tanya, exactly what is Dr. Dunn worried about?
Well, the surge in cases of COVID-19 has state health officials extremely worried. They're calling on Governor Herbert to make some major changes in order to try and slow the spread. But what they're asking for is big, like returning the state to orange and making face masks mandatory.
So we are definitely seeing a dramatic, real increase in COVID-19 in our state.
For the past 26 days, Utah has seen a surge in cases of COVID-19, with hundreds of new cases reported every day. And it's worrisome to state health officials.
You know, as we go down in colors, as you could say, I guess, green doesn't mean go, doesn't mean we're good to go. The risk of getting COVID-19 right now is actually higher than it was a couple months ago when more people were staying home.
On Friday, a memo was sent to state and local leaders from the Utah Department of Health. In the memo, state epidemiologist Angela Dunn said, quote, "We're quickly getting to a point where the only viable option to manage the spread and deaths will be a complete shutdown." She says if the state does not get down to an average of 200 new cases per day by July 1st, we should return to orange.
Honestly, if we continue to see spread like this, it's going to continue to hurt our economy. You have to have healthy workforce to have healthy economy, and they go hand in hand. You can't remove one from the other.
Dunn is urging state officials to stop lessening restrictions until July 1st. Friday's memo was sent less than an hour after the governor moved much of rural Utah from yellow to green. One more thing health officials are requesting, that face masks be mandatory by either government or business enforcement. Some cities, like Phoenix, are already requiring all residents to wear them.
We really need to have everybody wearing masks for that to be effective.
We are live out here at a testing site in Salt Lake City. Let me just show you the line really quick. Cars stretch around the block, and if you're at the back of the line right now, you could be looking at a several-hour wait. But should you run out and get tested for COVID-19, Salt Lake County started offering free testing last week at sites like this, but it isn't really meant for everyone. Right now, the county is doing hotspot testing, but it's just for areas that are seeing a surge in cases. So while they won't turn you away, you don't necessarily want to come down to one of these free sites unless you live in the neighborhood. Deanie, back to you.
All right, good to know, Tanya. Thank you.